gastrin receptors, gastrin acts via activation of the cholecystokinin receptor, also known as the CCKB or gastrin receptor, which has equal affinity for cholecystokinin and gastrin. These receptors have been localized to parietal and enterochromaffin-like cells, but it is likely that the enterochromaffin-like cell gastrin receptor is of greater importance in regulating acid secretion. Next, coming to the regulation of gastric secretion. So, gastric secretion is regulated by a complex mechanism that controls the gastrin release from the antral cells. Two meal-related factors stimulate gastrin secretion, that is gastric distension and amino acid. Low-grade distension activate this VIP, vasoactive intestinal peptide neurons, that stimulate somatostatin and which inhibit the gastric secretion. Higher grade distension causes cholinergic activation that reverses the pattern to one of increased gastrin and reduced somatostatin secretion. Amino acids induce the gastrin release. Direct action on the G cell have been demonstrated, but amino acids also activate both cholinergic neurons and bombesin neurons. The release of bombesin, also called gastrin releasing peptide, from mucosal nerves directly stimulates the G cell. Somatostatin is the major inhibitory paracrine regulator of gastrin release. Gastrin itself contributes to this process by enhancing the secretion of somatostatin. So, cholinergic activation after gastric distension or in response to a meal promotes acid secretion by shifting the balance of stimulatory and inhibitory mechanisms towards the stimulatory side, directly activating the parietal cell and stimulating gastrin release while suppressing the somatostatin release. So this is the summary. So gastrin increases the acid secretion. So gastrin induces the gastric parietal cell and enterochromaffin cell producing histamine and increases the gastric acid secretion. It influences the gastric antral smooth muscle and results in the antral peristalsis. So there is a weak action of gastrin on pancreas that resulting in the enzymatic secretions. Next, coming to histamine. So histamine is a powerful stimulator of HCl secretion from stomach. So it is localized in both mucosal mast cells and in endocrine cells, the latter called enterochromaffin-like cells, because of the silver staining properties of the granules. These cells are located in the acid secreting oxyntic or body mucosa in direct proximity to the parietal cell. So histamine acts on the H2 receptors on the parietal cells and increases intracellular cyclic AMP as second messenger. So cyclic AMP stimulates protein kinase, which increases the activity of hydrogen potassium ATPase and HCl secretion. Histamine release is stimulated by both acetylcholine and gastrin. Gastrin is the primary stimulus to histamine release from ECL cells, as we saw in the previous picture. So this ECL cells also directly stimulated by adenylate cyclase, activating polypeptide and vasoactive intestinal peptide. Somatostatin is a major direct inhibitor of histamine release. Calcitonin gene related peptide CGRP, peptide YY, prostaglandins and release. So inhibitors of histamine forming enzyme histidine decarboxylase block the acid secretory response to gastrin but not to histamine. The effects of histamine are largely mediated by H2 receptors, which explain the efficacy of H2 receptors blockers in the treatment of acid peptic disease. So thus histamine is considered as a major mediator of HCl secretion. Therefore, patients with peptic ulcer are usually first treated with histamine type 2 receptor antagonist. Next, coming to somatostatin. So somatostatin is secreted from the D cells of the gastric mucosa. Decreased pH of gastric content, that is less than pH 2, increases the secretion of somatostatin, which inhibits the gastrin release. As gastrin is the most potent stimulator of acid secretion, decreased gastrin release decreases HCl secretion from the stomach. So somatostatin primarily acts by suppressing gastrin-stimulated release of histamine from the ECL cells. So it is also affected by neural inputs. It is suppressed by activation and increased by VIP activation. So next, coming to the acetylcholine. So neural input may serve as an important integrator of secretory function. The mucosal nerves containing acetylcholine, Bombus and VIP, PA, CAP mediate the response to the cephalic phase of the acid secretion and to gastric distension and amino acids. Acetylcholine is the major stimulatory mediator. Acetylcholine is an effective stimulator of gastric acid secretion. It acts on the M3 cholinergic receptors on the parietal cells and increases intracellular calcium. It acts directly on the parietal cell to increase HCl secretion and acts indirectly by secreting histamine and gastrin from ECL cells and G cells respectively, that in turn stimulate parietal cells. So this picture shows the factors that increase HCl secretion and factors that decrease HCl secretion. So the factors that increase HCl secretion are luminal factors, hormonal, neural factors and blood-borne factors. First is luminal factors, that is distension of stomach and products of protein digestion increases the HCl secretion. Hormonal factors like acetylcholine, gastrin and histamine increases the HCl secretion. Neural factors, that is vagal stimulation, increases the HCl secretion. Both cholinergic and non-cholinergic. Both cholinergic and like epinephrine increases HCl secretion. Factors that decrease HCl secretion are luminal factors include increased acid content, that is highly acidic chyme. Hormonal factors, that is somatostatin decreases the gastric acid secretion. Blood-borne factors, secretin, GIP and glucagon decreases the gastric acid secretion. Thank you, students.